in the United States has changed dramatically during the past few years. There are a number of reasons for the changes, but the end result is very clear. Patients aren't being kept in the hospital as long as they once were. The levels of federal and private insurance funding available have changed the role of hospitals and have shortened the stay of the average patient. This means that many physicians now discharge patients earlier than was the case just a few years ago. It allows patients to return to the familiar surroundings of home once their condition is stabilized. Patients who are discharged no longer require the high level of care provided in the hospital, but many do need continuing care, which can be provided in the home. Health care in the home is not a new concept. Those of us who have been around for a while can easily remember when doctors routinely made house calls. And that essentially is what home health care is all about. The doctor can direct a team of healthcare professionals who come to the patient rather than the patient coming to them. Home health care offers many advantages for patients and their families, and we'll go into more details on that topic later. Different illnesses and injuries obviously require different kinds of care. So right now, let's look at some specific examples of just how the home health care system works.
Healthcare nurse.
My name's Gina Dotson. How
Gina,
are you?
I'm Robin. Come right on in.
Thank you.
Mom's waiting for you in the back bedroom.
Mrs. Johnson is 72 years old, has diabetes, and has suffered a stroke. Just a few years ago, she would have spent approximately 11 to 12 days in the hospital recovering to the point that her physician would discharge her. But now, with home health care and its wide range of services available, stroke victims spend only about 7 to 8 days in a hospital.
Mrs. Johnson, you suffered a rather serious stroke, but with all things considered, your chances for recovery are very good. Now, we hope to have you up at home.
Now that Mrs. Johnson is in the hospital, her team of healthcare professionals begins working toward one goal: to get her well and to restore her to as full a life as possible. In fact, based on experience with similar types of patients, healthcare professionals have an excellent core of knowledge with which to work in planning Mrs. Johnson's recovery and rehabilitation. They know, for example, that barring unforeseen complications, the approximate amount of time she will spend in the hospital. So they begin work toward planning her discharge and subsequent treatment almost immediately.
You people here at the hospital are taking such good care of Mother. You really seem to care. I don't know what we'd have done without you, but the doctors say Mother will be discharged in a few days, and frankly, I don't know what we'll do then. I mean, really, there's just no way we can do the things for Mother that need to be done.
It's natural for you to be anxious as we're getting ready for your mom to go home, but actually you've been right here with me, helping me as we bathe her and as we learn to feed her and positioning her, so it'll be natural as you go home. These skills that you've learned here, you'll just pick up and carry on. There'll be a discharge planner to help you work with those, so it'll be a very smooth and easy transition for you and your family.
This obviously is no time for the patient's family or the patient to be worried unnecessarily over the nuts and bolts of her care and recovery. But of course, there are nagging questions, such as, who is going to take care of me? And how am I going to pay for the care? That's where the hospital's discharge planner comes into the picture.
Hi, Mrs. Johnson.
This healthcare professional, who is usually either a nurse or a social worker, is trained and experienced in handling any situation or problem which might arise related to the patient's discharge. It is the discharge planner's responsibility to help the family and patient anticipate problems and solve them as they arise. The date of a patient's discharge from the hospital is the decision of the physician. So the discharge planner works closely with the physician and the rest of the team to make sure that Mrs. Johnson's transition from a hospital environment to a home environment goes as smoothly as possible.
But let's talk about Mrs. Johnson's case for a minute.
Okay.
Unless some complications arise, and I don't think they will, but she should be going home within a week. So we need to start putting together the various aspects of her home health care treatment plan. She'll need the assistance of a physical therapist and a social worker and a speech therapist.
A stroke victim's recovery is multifaceted, as is the case with most illnesses. During the recovery period, a number of healthcare professionals representing a wide variety of disciplines will be involved in the patient's rehabilitation process. This team concept in rehabilitation begins in the hospital and continues after the patient goes home.
The team could consist of some or all of the following: doctors, nurses, social workers, respiratory therapists, physical therapists, dietitians, speech therapists, and other technicians. Each member of the home health care team is very important to the patient's recovery. Also very important to the recovery and rehabilitation process is the proper medical equipment and supplies. After consulting with the physician, the discharge planner will know what equipment the patient will need as part of the home health care plan.
And as with many other things, the discharge planner will assist in the arrangements for the proper equipment and supplies to be delivered to the patient's home. Even before the patient arrives home from the hospital, everything necessary for the patient's recovery and rehabilitation will be set up, adjusted, and tested by specially trained technicians to make sure that everything is in place and working properly. These professionals will train the patient and family members on the proper usage of the equipment and supplies. The stage is now set for the patient to return home. The discharge planner has been in continuous contact with the physician, making sure that all aspects of the patient's care at home are taken care of. It is important to note that the physician authorizes the entire home health care plan.
Almost there.
When Mrs. Johnson arrives at home, a schedule is worked out to ensure that she gets the care and treatment ordered by the physician.
I'm getting pretty good at this.
Home health care workers treat each case individually based on each patient's individual needs.
Mrs. Johnson, I know you're glad to be back at home, and we hope to help that stay at home just do wonderful for you. We will be providing some services that your physician has ordered, one of which that will be very important for you is your physical therapist that will be coming to see you every few days, 3 or 4 times a week, to help you with your activity around the home. We'll also be sending a social worker who will help you with any other problems that you may have, as well as the nurse, and I will be here to help monitor your sugars, your blood blood pressure, and help you with your medication schedule. If you have any questions for any of us, please feel free to ask us at any point, and we'll be available to assist you in your stay here at your home. This machine is something that we will be working with you on, and this will help to monitor your glucose levels. And if we run into a problem or an elevated level, we'll be able to let your doctor know, and he'll be able to make adjustments in your medication. I will also be instructing your daughter in the use of this, and she'll be able to help. You probably will be monitoring them twice a day, and as time goes on and your levels are more stable, we'll be doing it maybe just once a day.
The home health care nurse offers skilled care, the same caliber of care provided in the hospital. And that holds true for all the other home health care workers who will be caring for Mrs. Johnson. Home health care could possibly be looked upon as the best of both worlds, high-quality health care and supportive services, but with all the comforts and convenience of being at home.
Oh, Mother, look at your plant.
A patient receiving health care in the home obviously has much more freedom than someone confined to a hospital environment. Within reason, a home health care patient may do what he or she wants to do when he or she wishes to do it. Although confined to the home, the patient is not restricted by hospital schedules concerning such matters as when to have meals, when to have visitors, what to wear, and so forth. And many healthcare professionals agree that a home environment with the patient in familiar surroundings is far more beneficial than remaining in the hospital. In the home, the patient has family members who can assist the healthcare professionals in performing certain duties.
Robin, have you noticed your mother having any problems with her balance while she's walking?
And just having the family close by means a lot to the patient. And the fact that the patient is at home helps the family lead a more normal life. How well does home health care work? The fact is, it works very well. All across the country, every day, thousands of patients who once would have faced extensive and expensive hospital and nursing home stays are being provided top-notch health care in the privacy and convenience of their own homes. And the care is provided at a fraction of the cost of being a hospital inpatient.
Now, you may be thinking that home health care is just for the elderly. Actually, nothing could be farther from the truth.
Yeah. Oh.
In fact, many home health care patients are infants and children with conditions which once would have required long hospital stays. Now these children can be discharged from the hospital much earlier, and their long-term continuing medical needs can be met in an efficient, timely, cost-effective way through home health care. Baby Corey Simpson was born several weeks prematurely. During his first few days of life, Corey had a slightly irregular heartbeat, which doctors felt warranted monitoring.
Then what you want to do is slide the band underneath his chest where it...
Infant apnea monitoring is just one of many home health care services available to newborns and was recommended to Mrs. Simpson by her pediatrician and the discharge planner as an alternative to extended hospitalization. Home health care professionals arranged for the delivery of the monitor to the hospital so the parents could be trained in its use before taking the baby home with the apnea monitor. Corey's parents were then trained to operate the monitoring device and were instructed about what to do in the event of an emergency. Instead of keeping Corey in the hospital for an extended period of time, he was allowed to return home with his mother. By taking advantage of this home health care service, Corey's parents were able to avoid the expense of a lengthy hospital stay without sacrificing the care their child needed. And these same benefits hold true for patients of any age.
Ow! Ow! What happened?
Take, for example, the case of teenager Joan Harris, who stepped on a rusty nail while hiking with friends. The nail not only pierced the skin of her foot, but penetrated the bone, resulting in a bone infection. Joan's treatment involved IV antibiotics for 10 days. Not too long ago, she would have been hospitalized for the treatment, but Joan's parents were told she could be given the necessary care at home with the aid of home health care professionals. A home health care nurse was on hand to get Joan's treatment started. She worked with Joan's parents on how to begin and end the treatments, as well as how to care for the IV catheter and site. Her parents learned quickly, cutting the number of nursing visits from 2 times a day to 2 or 3 times a week.
You need to give a medication over 30 minutes.
Joan's treatment progressed without incident. She spent the days at home in the comfort of her own room, where her friends came by nearly every day to visit and drop off the latest homework from school. For Joan and her family, home health care made the best of a bad situation and kept medical bills to a minimum.
Yes, home health care does have very much to offer to patients and their families. And we want to make sure you understand the home health care options available to you. We hope that viewing this program has been helpful to you in understanding the home health care system and the advantages it presents. If you have any questions concerning home health care, including financing, please feel free to ask your discharge planner, your doctor, nurse, or social worker. Any of them will be happy to explain the many advantages of home health care to you and help you with the details.